Before we get started with our class, I'd like to introduce Candy Wenke, who is our stroke coordinator, and she's going to talk for a few minutes about why we're doing this and what's going on. Go ahead, Candy.
Thank you, Diane. I'm Candy Wenke, and I'm the Stroke Center Coordinator for Kaiser Santa Rosa. Welcome to this class. I'm going to come because I'm really kind of excited about what we're doing right now with stroke care. 2,400 years ago, stroke was first described by Hippocrates, but they didn't do anything about it as far as symptoms or relief until the last 10 years. In the last 10 years, it's been amazing what's been going on. The last 5 years, especially technologically, we are behind heart as far as stents and defibrillators and all of those things that have gone out for the American Heart Association. But we are rapidly catching up. We can now put in stents for stroke. We can put in, do a brand new treatment called penumbra, which is a mechanical clot extricator. It will go in, it will break the clot up, and it actually vacuums the clot out. And we have TPA. And all of this has been in the last 4 or 5 years, and this has really improved stroke care. Patients that come in with stroke symptoms, if they're within the 3-hour mark, they can get the TPA if they follow all the inclusion criteria. You'll be learning more about that today. The goal of that is that within the following year, the statistics have been that 30% of those patients, the sequelae of stroke has been reduced dramatically. That is, if they had not had TPA, they would have gone on to be stroke patients with major disabilities. So we're doing well with the TPA, and that's a big part of the Stroke Center right now, that the government would like to see more stroke centers. A joint commission is brought on board right now to approve hospitals that are applying for a stroke center certification. It was the key change in the impetus for stroke care in this nation. What that means is that we will be working on 10 performance measures over the next several months and trying to achieve stroke center certification. Those performance measures have to meet the benchmark of other already existing stroke center certified hospitals. So that's where we're going. That's our goal. And what my hope is that when we become certified, we're going to impact the lives of many more stroke patients because it will become the state-of-the-art care here in Kaiser Santa Rosa. In other words, we will be impacting stroke care on the same level Stanford, Boston, everyone who is currently a stroke center that's certified, because all the stroke centers have to continue to change with evidence-based practice currently. So you won't need a second opinion because you will have the same exact practice at all these existing hospitals. Joint Commission goal is to make the changes as evidence comes in and is verified to be good evidence as far as practice change. I started this position in September, and already in January we've had to make changes. So this is going to be an ongoing process. With that, with the Stroke Center that we're involved in now, I went to New Orleans at the convention center, and they came up with 2 exciting things for me to bring back. One is this, all of this data. That's what's in this packet if you picked it up. And what it is the nation is looking at California right now, because in 1998 we all voted on to ban smoking in the public places. And so in New Orleans they wanted to know, did that make any appreciable effect? And as you can see, in the first part of this graph, I'm not sure you can see it up there, but the nation and California are stroking and smoking away until 1998. And the top line is the nation that's still stroking and smoking, and the bottom line are the strokes that went down dramatically. So with just voting, we made a big difference in strokes here in this state. That was huge. The other real big difference, besides our technological advances in the last 4 or 5 years, is finding out that risk factors. If we reduce the risk factors for the stroke patient, we reduce stroke by 80%. And that's a huge number when you think about 8 out of 10 people and all of those, because they reduce their risk factors. Their chances of having a stroke is much less. So I put in this and it's your brain basics, and it says, do you know your risk of strokes? And it's just a quick little test for you as women and for men to find out what is the likelihood of your stroke for the next 10 years. So that's kind of interesting. It's hard to reduce risk factors, but it's even harder if you don't know what the risk factors are. So that's what we need to do. Our public message has to get out to people, just like American Heart Association got their message out. Of what, if you have any signs and symptoms, come in, not drive in, come in 911 immediately so that you possibly could get in that 3-hour window. And how to prevent those signs and symptoms, well, that's your risk factors. If you smoke, quit. And we're going to go on with the rest of this class, and we'll let you know what the rest of that risk factors is. The one thing I did do is develop this binder, and it's the Stroke Alert Protocol binder. And what this is going to be on every unit in the hospital. The ED, the Second West, and ICU will have a specialized Stroke Alert binder. And in here is all the protocols, all the how to make TPA, the slide rules in case your decimal point's off a little bit. You can always do your math and then double check with some a degree of confidence. Everything you need, there is a primary RN checklist in here right in the very first section. So when we call a stroke alert, you're going to be able to say, okay, we did that, we did that, we did that. And it'll just be a disposable piece of paper, just a checklist for you to make sure that you covered all the bases. So that's available on all the units in case the stroke alert team has to go to 4th floor and 4 East, or heaven forbid, 3rd floor with pediatrics or OB. They at least have a quick reference because that team might not have done the stroke alert for 6 months, and it would be good for everybody, just peace of mind to know that they can get their hands on a checklist quickly. So that's what that's about. So on that note, I'm going to turn this over to Diane, and I just thank you so much for coming to this class.
Thank you, Candy.